Can't get down on the floor or even sit in a chair without your back screaming at you? Do you think it's just arthritis and there's nothing you can do? Here's what nobody's telling you. Your joints aren't breaking down because you're getting older. They're breaking down because of what's happening with your spine's alignment right now. In this video, you're going to see how your posture is the missing piece everyone's ignoring, what's really accelerating your joint breakdown, and the 3 simple core exercises that protect your back. I'm Dr. Ryan Wolfert. Let me ask you something. When you look at yourself in the mirror from the side, or when you see yourself in pictures, do you notice you're not standing as tall as you used to? Maybe your shoulders are rounded forward, your mid-back is hunched, your hips and pelvis look tucked under with your pants cinched up so tight to prevent them from sliding off because you got no butt. Here's what's really happening with arthritis in your back. You know, for years, doctors have told us it was just wear and tear, that something just happens and it's something that happens when you get older. But we know that's not the whole story. Yes, the cartilage between your bones breaks down and that causes pain and stiffness. But here's the part nobody explains. Your posture and the way your spine is aligned directly affects how fast that breakdown happens. When your spine and posture is properly aligned, you've got 3 natural curves, one in your neck, one in your mid-back, and one in your low back. And when those curves are balanced, the stress on your spine, your discs, and your joints stays minimal. Your body can actually heal itself. But here's the problem. Years of sitting at your computer, looking down at your phone, holding your kids or grandkids, old sports injuries, car accidents, even just the way you've been moving for decades, all of that causes your spine to shift out of alignment. And most of the time, it flattens that low back curve. When that curve flattens, your hips and low back can't move the way they should. Joints that are supposed to glide smoothly start grinding. Certain spots get hit with way more stress than they were designed to handle. And that speeds up the breakdown that leads to arthritis and pain. So now let me show you 3 exercises that actually work with your body to support your spine, protect your joints, and give you real lasting relief. First is the abdominal brace. Now this teaches you how to turn on your deep core muscles. These are the ones that stabilize your spine and take pressure off your joints. You don't need any equipment for this. You can do this standing, sitting, kneeling, wherever. You know, many times experts will tell you to lie on your back, but I disagree. I found standing, kneeling, or being on all fours is the easiest way to learn this, especially if you're having trouble. And one of the best cues I've found to help patients perform this hollow abdominal brace exercise is this. Envision someone is about to hit you in the stomach. What will your stomach do? It will draw in, contract, and brace, ready to absorb the blow. With this ab maneuver, your stomach will go in, not out. But you're not sucking your stomach in. You're not holding your breath. If you put your fingers just above the front bones of your pelvis, you should be able to feel the muscle go in and contract. So in the beginning, just aim for 1 set of 10 reps of this abdominal brace exercise. Now, each rep is 5 to 10 seconds. So as you bring the belly button towards your spine and you're bracing your core muscles, that's 1 rep, hold for 5 to 10 seconds, and then relax. And then do it again. And do that 10 times, 1 set per day. And then after a few days of getting used to that, of learning it, now you can add another set and then another set a few days after that. So where you're working up to around 3 to 6 sets of 10 reps each day. Now, a second exercise is called hip thrusts. So with this one, you're gonna sit on the ground with your upper back resting against a couch, your bed, or a bench. Your knees are bent and feet flat on the floor. From here, you're gonna brace your abs, like with the abdominal brace exercise, and then drive your hips up towards the ceiling until your body forms a straight line from your knees to your shoulders. Squeeze your glutes hard at the top. Hold that for 5 to 10 seconds and then lower back down. Start with 8 reps and you can work yourself up to 15 reps and try to fit this into 3 to 5 times during your day as little movement breaks. This wakes up your glutes and gets blood flowing to your low back, both really important when you're dealing with arthritis. And now third, we have low back towel traction. With this, you're gonna lie on your back and place a rolled towel right under the curve of your low back, between your last rib and your pelvis. That's it. You're just going to lie there. You start off with 1 to 2 minutes once a day. The best time to do this is right before bed. If everything else feels fine, no pain, no numbness, no weird sensations, you can add another minute or two the next day. Keep building that time until you're up to 20 to 30 minutes each day. This gently supports that protective curve your low back is supposed to have. These 3 moves work together. They're specifically designed to support your spine in a way that takes stress off your joints and slows down that breakdown. They're safe, they're simple, and they address what's actually happening structurally instead of just masking the pain. But with these or any other exercise, you don't want any pain. You want to do them pain-free. They might feel a little uncomfortable at first, but it shouldn't be unbearable and causing pain. But hey, I get it. You might need to go deeper with how you are and figure out exactly what's happening with your posture and spine and get a plan tailored specifically to your body. And I'd love to help you with that. So what you can do is you can just click the first link in the description and you can book a virtual house call with me. There's no charge for it. We'll go through your situation. I'll show you what's really going on and we'll map out a plan to fix it long term. It doesn't matter where you are in the world. We can do this online and anywhere and we can help you get answers and so you can be your own guarantee for your health and your life.